Nobody in my time did the things that occur now, because in my day, drugs for treating mental illness had not yet been developed in any large amount. So when I was a young practitioner, there were a few drug companies that found it worthwhile to buy my time. So if I didn't succumb to temptation, part of it was that there was no temptation then.
When I started out in medicine, which is now over 60 years ago, medicine was not viewed as an industry. Nobody called it an industry. Most people thought about medicine as a professional social service, and the name of the game was to provide good health care to everybody. Over the last several decades, things have changed, and we have huge numbers of investors owning and operating insurance companies, medical facilities of all kinds, and they're in it for the money. In 1963, Kenneth Arrow, who later won the Nobel Prize, published an article in which he explained very clearly why health care was not a market like other ordinary commercial markets, and why the laws of supply and demand didn't apply to health care. He points out that medical service is often defined by an illness over which you have no control. It may threaten your life. You may be scared to death. You may be incapable of exercising any judgment at all. You have to depend on the expert, compassionate advice of your doctor. And your doctor, therefore, doesn't act as a vendor. He or she is a professional and is committed to put your interests ahead of his or her own interests, to serve your interests first. That's not the way it is in business. After investor-owned businesses got into the hospital field, apologists for investor-owned health care said, maybe you don't like the sound of it, but we're really more efficient. We really know how to manage organizations, and we're giving consumers, that is patients, we're giving consumers a better deal for the money. Well, it's just baloney. Yes, there was some evidence that at first investor-owned hospitals spent less money because they hired fewer RNs and they cut corners wherever they could. But there was never any evidence that the result was lower charges to consumers, to patients. If you believe that it's good to take money out of the healthcare system and put it into management and to profits and stock dividends, then you can say there's some advantage. But I have the old-fashioned idea that when we spend money for healthcare, we ought to be getting healthcare. Doctors have inevitably been drawn into this. Many doctors think of themselves as businessmen.
I think one of the key worries of hospital administrators today is the competition that their hospital is facing from physician-owned facilities, such as ambulatory surgical centers, imaging centers, endoscopy centers, or just, the ability of physicians to do more tests and procedures in their office. And why are they concerned? Because these are the most profitable services for the hospital, and physicians are building facilities often in partnership with venture capitalists or private equity firms to go into these businesses to specialize in what's paid the best.
One of the big questions in healthcare right now is what happens if organizations only do the profitable activities in the provision of healthcare and leave other organizations like community hospitals to do the rest of it. How will the hospitals continue to provide the emergency services? How will the hospitals continue to provide the neonatal, the critical care, and the other activities that the public has to have at points in time?
Given the proliferation of physician-owned facilities, this may have some effects of reducing unit prices of those services, because insurers are starting to perceive that they can squeeze some of those prices because there are so many places for the patient to get it. But experience in healthcare would suggest that any reduction in unit price would be scant comfort compared to the increase in the volume of services. The research on physician self-referral is just striking. The differences in the proportion of patients referred to for tests or procedures when the physician owns it than when the physician does not.